Our guest today is an aesthetic nurse practitioner that specializes in regenerative medicine, PRP, and also injectables. Please help me to introduce nurse practitioner Tracey.
Hi, how are you doing?
Good, good. I'm so glad you're able to join us today.
Well, thank you very much for having me.
No worries, no worries. So Tracey, I always like to ask my guests first, how have you been? I know there's a lot of crazy things going on in the world. How's everything been for you?
So it's definitely been a change. So I went from having a brick and mortar where I would see clients in an office to being 100% mobile at this point. So now I actually took everything that I did, pain management wise, all the aesthetic procedures, and now I go to the clients. So all the procedures I now do are in the comfort of their own home.
How do you like that? I get a lot of different feedback from different providers that do kind of concierge. How do you like that? And how is that for the client?
So for the clients, they definitely like it because then nobody truly knows what was done or anything like that behind a closed door. So they can get away with, I think, a lot more. For me, sometimes it's a challenge because of the different environments and the different lighting. So that was stuff that I had to figure out as I kind of went along. So now I have like a whole thing that I bring with me, a different, table that's a lot more comfortable, additional lighting, additional mirrors, so stuff that like I had in the office that was just, readily available. Now I have to kind of pack and take with me.
All right, nice, nice. Tell us, what type of services do you offer in the home? Or what type of services do they have to come to the office? Or can you offer it all in the home?
So I offer it all in the home. So I do my actual main focus is interventional pain management. So I do joint and spine injections. And with that, so I do hyaluronic acid injections and cortisone injections. But then if there's somebody that's young or old or whatever and they're facing surgery and they want to actually repair the issue, that's when I use things like PRP. So that's how I do it. I use PRP for rejuvenation for musculoskeletal, as well as for multiple aesthetic procedures like the facelift, neck lift, cellulite smoothing, Oshots, Pshots, hair rejuvenation. It's pretty limitless what you could do with the PRP.
Awesome, awesome. So what's interesting is when I first met you, I was trying to recruit you. And one of the main things I said is the spa wanted you to do some PRP. And you were like, PRP is not something you do in those little tubes and spin in a circle. PRP is so much more than that. And you explained so much more than that. I would love for you to explain to us now why PRP is so important and what you can do with it.
So when I hear that patients are like, oh, your prices are so expensive. And I kind of snicker because I know that what they're looking for is that $50 Groupon where they're going to draw blood in that little test tube. So when they draw blood in that little test tube, they're maybe pulling out 3 or 4 cc's, spinning it down, and they'll maybe get 1 cc of the straw serum, which is what the plasma is. What I do is definitely different. So when anybody says to me, I'm going to do a procedure, I actually give them a regimen to follow starting 2 weeks prior to the procedure.
Wow.
I do an extensive screening process because it is a growth factor that you're injecting. So there are certain people that are not candidates for these procedures. So if they have cancer or something that's autoimmune, they are absolutely not the people that should be injected.
Gotcha.
So when I go and do a procedure, I'm pulling a minimum of 60 cc's of blood. It is a huge syringe of blood, and spitting that down to definitely a smaller volume. But typically I inject, depending on what type of procedure it is, anywhere from in a face gets 10, 12 cc's of plasma that's injected. So that's a lot of fluid that's injected. Into joints, it's the same thing. I'm not giving them 1 cc. And because of the regimen that I have them follow, I can actually tell by how when I spin the blood, if they've done what they've supposed to do and what type of results they'll be able to expect and how quick they'll be able to expect those results and how quick they're going to be able to heal. So everything from the minute they start that process. So it's not the type of thing that when people say to me, oh, I went and I had 1 tube of blood done and, it didn't do anything. Of course not. A little tube of blood ain't going to do anything for you. It's really not.
Yeah.
You just can't expect it to.
Yeah. Now, I want you to kind of touch on a little bit of how important PRP is. So I know you work with different type of people throughout the world. What type of results can you expect from that? Like with your knee, right? You work with some athletes that you get amazing results. Can you touch on that a little bit more?
So, for example, I worked on a golfer who was recently in the Masters and tore the flexor carpi radialis, which is the muscle in the arm that helps with the golf swing. And he had major tear, extensive bruising, saw the orthopedic surgeon. Orthopedic surgeon said it was going to be a good 6 months of downtime, which for somebody, it's once a year. It's a big golf tournament, a lot of money at stake.
Yeah.
They want to be able to play. So for him, getting it healed and getting it healed correctly was extremely important because that's his career. So when I looked at it with ultrasound and saw where the tear was, I knew that if he did the PRP correctly, that he would be healed within 1 month of that procedure. So he had the procedure done and started therapy immediately because I always do that if it's for a musculoskeletal repair. 28 days later, when we did a rescan on the arm, it was 100% healed. Mm. And that same day we saw the orthopedist, I actually went with him, and the orthopedist could not figure out how we were able to do it. So using PRP correctly under ultrasound guidance for musculoskeletal procedures, it makes the world of difference.
Yeah, no, definitely.
I mean, healing wise, it's so much faster than like opening up a joint for surgery.
Yeah.
Where you're looking at a recovery of 3 to 6 months versus maximum of a month.
Wow, that's such an impressive thing right there. Why do you think, what's the stigma around it? Why aren't more people using this in their practices?
I think partly because, well, most people want to go through insurance. Insurance does not cover this, which you have to kind of weigh the pros and the cons. You're either paying for a procedure to have the repair, or the insurance is going to pay for it, but you're going to be down 3 to 6 months. So what's the cost of that? Yeah.
Yeah. And that really is true. Like, and that's my issue kind of with some insurance companies, right? It's not always the most effective method. It's just what's going to get you to the next step.
Yeah.
So no, that's great. That's amazing that you came upon this. Are you ever scared to inject in certain places? I know people are scared to inject in certain places. Tell me how you approach that.
So what I have found and what I've been told by others, especially even orthopedists, hips kind of freak them out a little bit because it's in that joint, there's huge vessels that are right there. Mm-hmm. And you really can't miss, because if you miss and you hit the femoral artery, you're going to have some problems. Yeah. So, when I hear somebody says, oh, they injected it blindly, I'm going, oh my God, like, you're lucky you're alive, So am I afraid to do them? No, because I can see everything that I'm doing. And the cool thing with the equipment that I use is it has a needle guidance system built in. Wow. So there is absolutely no way I'm going to miss. So unlike other people that do these procedures, I guarantee my work.
Wow, that's amazing. That's great.
So in all the years I've been doing this, I haven't given anybody their money back yet. I've never had anybody have a bad outcome. Mm. Not many people can say that.
Mm-hmm. Yeah, for sure. So let's go back to the beginning. How did you get started and what made you want to join this crazy industry?
So what started it is, so I did internal medicine. That's my background. Yeah. I did that forever, years and years in urgent care. And I started working for an interventional pain management specialist. And I was there for about a year. And in that year, I figured out we do a lot of cortisone. And it helps people temporarily. But they are always coming back because they're still in pain. And I couldn't understand, like, there was no way to really fix these people. And that was kind of like the whole thing behind it. I wanted to be able to fix them so that they didn't need to keep like having procedures done. And that's kind of where it started from. So after I spent a year there, I started researching different systems for PRP. Mm. And that's when I learned that little test tube that they draw really isn't PRP. So I only use one system. I use the M-Site system. Okay, so after I did all the research on PRP and figured out which system I was going to use, the next step was getting trained. So the office that I was renting space in, I didn't have a fluoroscopy, which is the big machine for injecting joints with live x-ray. So I had to figure out a way to inject joints and be able to see what I was doing. So my next step in the process was learning ultrasound. So I learned how to perform the ultrasound, read the ultrasound, spend a lot of time with radiologists reading other types of ultrasound. So I learned spine and all the extremities, and even for facial and for like penile injections. And then from there, it was like the jump off point. So I was working, renting space and doing my own thing, doing the aesthetics and the musculoskeletal. And then COVID happened and that office shut down. And then it was like, well, what am I going to do? And the good thing about having the ultrasound was that I figured out I was mobile. So I didn't have to be in one spot. And then it was just, getting the rest of the gear together and figuring out how to pack everything so I could take everything with me and do it that way.
Wow, that's great. I feel like that's going to lead into more people doing concierge, honestly. That's the way the world's moving. No one wants to go in the doctor's office anymore with everything going on. So you're just ahead of the game.
A little bit.
Yeah.
I think so. I mean, especially with, the fact that now we can have x-rays done at home. We can have lab work done at home. Now we can have all this stuff done at home. And you get to recover in your own home, in your own comfort.
Yeah.
So it's not like after a procedure where you have to get in the car or have somebody drive you. You are already there.
Nice.
So,
what trends are you seeing in the market now and that are hot right now people are using besides the PRP?
Well, I've seen a lot of people do PDO threads. That's actually a very, very big thing. I went and actually spent the money and got trained on it. And I actually found I like doing PRP better than the PDO threads. I've never had somebody say, can you feel this on my face? It's like right below the skin. And it's like, feels like it's going to come through. You don't get that with PRP. So even though I understand the concept behind the PDOs, and do I think that they work? Yes. But I think if they don't screen those people properly, if they're not placed properly, I think the after is worse.
Yeah, no, I can definitely understand. Now, you also specialize in injectables, but I know behind the scenes before we start, you were telling me that you actually use PRP as an injectable sometimes. So can you tell us a little bit about that and then the injectables that you do like to use also?
So I use PRP as a filler. So instead of the regular fillers that people get put in their face and whatnot. So the fillers, when they do that, they last 3 months, 6 months. When I do it PRP as a filler and they put it in, it stays.
Yeah.
So it's not going to dissolve in 3 to 6 months. It's going to have that scaffolding if they've done the prep correctly, and it's going to stay. So if they decide in the future that they need a touch up, that's another story. But typically they don't have to come back for Botox every 3 months, because when I do like the facelift procedure, when I take the PRP to do their forehead, in the end, after I've done the lift, I will microneedle with PRP and a peptide that has a Botox quality. And I could freeze their forehead for over a year.
Wow.
So why would you want to go every 3 months and spend $400 or $500 on Botox when you could do this once and have the results stay?
Yeah. Wow. No, that's every time you say something, I'm like, wow, that's interesting, because if people actually knew about this, I don't know if they would necessarily be doing the injectable route.
I know. I definitely couldn't see why they would be, because every 3 to 6 months you're going back for to be reinflated.
Yes.
So, and there are things that I can also give them after procedures that will help them maintain the look even longer. So it's just the tricks of the trade. It's, you get what you pay for.
Yes. How do you feel about the South Florida market since you've been practicing? How things change? What are your opinion on that?
I think consumers are a lot more educated. So, and that's a good thing. They should be. I definitely feel that if people are actually doing the research out there, they're going to figure out that not all PRP is the same. They are not going to get the same results from a little, 1 cc versus, 60 cc's of blood. It's night and day difference. And I think that's really been the biggest change that I've seen. I will say that since I've started, the costs for things have definitely gone up. Procedures that used to, musculoskeletal procedures, aesthetic procedures that I've seen, a lot of the spas are very, very competitive, like with Botox per dollar per unit. I don't like to play that game. So I figured, I've seen dentists inject Botox, and I look at it this way, you're getting what you pay for. So I'm the person that they go to when they want it done, that it's going to be nice and smooth. They're going to look completely refreshed. They're going to pay for it, but they're going to look amazing, that they're going to be able to go out the next day and look like they've had a complete facelift.
Yes, and that's a good thing to say, because I remember you showed me a picture of a patient that you actually did the PRP on, and it was like night and day. And you said she went out and had a drink the next day. Mm-hmm. It's crazy how much you can do in just a matter of a couple hours. Yep.
So typically when I do just a face, just straight face, it's about 3 hours to do the facelift. When we do a face and a neck lift, which lately I've been doing a lot of that combination.
Yeah.
It's about 3.5 to 4 hours.
Wow.
So obviously I give them little breaks in between, and the last half hour they usually enjoy because we do a certain mask at the end to help them heal a little bit quicker. It's all tricks. But it's definitely night and day difference that they notice. Like people, like they're looking to see like, where did they get cut? And they didn't get cut. They may have a bruise or two, but those bruises heal so fast that within 24 hours they're able to go out and go out with their friends and go to the store, and nobody will really know what they've had done.
Wow. Like a little weapon, the secret weapon.
It's like the secret weapon to turn back the clock.
Yes. So you say you do nerve blocking too. Mm-hmm. How difficult is that, and how did you learn how to do that by chance?
So that was where my pain management background came in. So when I started doing all the injections for patients for cortisone, and so one of the things I learned is how to do a nerve block. Really helps with the aesthetic procedures, because when you inject somebody and you're doing a lot of injections for either the face or the head, you give them one injection, numb them, and they don't feel the rest. Makes night and day difference. So if they don't want to go that route, I do have topicals. So I always have what to offer. If they want it done topically, we can do it topically. If they want it, there's actually a couple of other tricks that I have that we can use for numbing the skin in addition. So we can do nerve blocks, topicals, use gate theory to like facial ones that vibrate. So if they're afraid of using any type of drug, because I do have clients that, I don't want any drugs whatsoever to numb things. So
super interesting. Super interesting. Now, for providers that are in the aesthetic industry, that are practicing like in a med spa or things of that nature, and they're interested in getting into regenerative medicine, what are some conferences or trainings they can attend? Because regenerative medicine is becoming huge, especially in South Florida. It's like almost like a combination between aesthetics. So what are some conferences maybe they can attend?
Well, I know that A4M is very, very big. But in all honesty, what I did when I was getting trained is I actually went to the people who developed the procedures. So I asked around, I'm like, who did this? And then I would just call them and say, listen, I don't care how much it is. I want to get trained by you because you're the one who did it. And that's where, what I can say to them is I really went to the source on a lot of them.
And that's good, because the source knows best, right?
Yep. So at least that way I had the building blocks. So I could, do the procedures and tweak the procedures, and then knew what I could do to make things better.
How often is things changing in that industry? Do you have to get education every year, or tell us a little bit about that?
There's always something new. There's always a new injectable. That's the kind of the cool things I've seen, is that there's always like new peptides that are out that can be mixed. And I'm now working with another company that has a lot of stuff in the regenerative market that will actually make the procedures that I do last way longer then. So I used to be able to kind of guarantee that a face, like I could easily keep a face year and a half where you're not going to move a forehead. But if I could get rid of those lines and make those lines go away for 5-6 years at a clip, that would be a night and day.
Yeah.
Yeah. So that's now what's coming out that's new.
Wow, that's really cool. Wow. And you just constantly finding out new things and pushing the pen forward.
Always.
Are you doing like research studies or sharing this information?
I'm not doing research studies, but I'm always like, I really don't do much on the downtime zone.
Yeah.
There's always something new to learn. There's always something, new that's coming out. So there's lots of different things every day that are sent across my desk. And
Gotcha.
It has to be pretty spectacular for me to consider it. But like the new stuff that is coming out now actually has my attention because it actually has FDA approval. So the fact that it has FDA approval and can be used regeneratively is a huge thing. So when the FDA approves things, insurance covers it.
That's true.
So then musculoskeletal repairs will be much more readily able and available for people who have insurance.
Nice. Wow.
So it's always evolving.
Yes, for sure. Now, I wanted to touch on again the concierge medicine part.
Mm-hmm.
Now, I'm assuming, do you use Facebook or Instagram to gain clients, or is it more referral? Or tell me a little bit about that process.
So I'm new to like starting as a mobile. So
Yeah.
I had my own brick and mortar. I did it for years. A lot of it was by referrals. I started this officially. I started like the whole concept process in November. Started seeing patients in January mobile. And it's been Facebook posts, Instagram posts, a lot of word of mouth, a lot of referrals from other clients. So that's how I get a lot of the referrals.
And I always say, like, when a provider gets referrals word of mouth, that means they have great patient care, right? Because you have to trust that this person's telling you what they're telling you and it's going to work out. You're not really doing too much effort on your own.
Mm-hmm.
So that's great that you're getting most of your clients through word of mouth.
Yeah, it is. Because aside from the fact that I guarantee my results, which is like a huge thing, referrals word of mouth is beyond huge, because that means that person was happy enough to share with somebody else that they had this much success and they thought the other person would benefit from it. So that's something that's very important to me.
So you guarantee your results. That's an interesting point. And the reason I say that is because, like, when I go to visit these different facilities, they always say, never guarantee, if the patient comes back or something that's not right, it's your fault. Because you should always say, I think this might happen, or 60% of this might happen.
Mm-hmm.
Have anyone ever came back and said that they didn't expect the results that they wanted? Or
not yet. So that's why, like, I give them a prep that's 2 weeks prior to. Mm-hmm. So prior to even doing like a regular facelift procedure, I examine them as an internal medicine client. I want to know what medications they're on. I want to know what vitamins they're taking, because everything that they put in their body will affect the PRP that I get and that I'm going to be injecting. So I can understand why people won't guarantee their results. So if my patients are doing exactly what they're supposed to, their results are ridiculous. Mm-hmm. That's why they look the way they do. That's why they have the hair growth that they do and their faces look the way they do. It's pretty amazing if they actually do it correctly, how much it can turn back the clock and how much repair can be done.
Mm. How big is community in this industry?
Like with other providers sharing? Mm-hmm. Great question. I don't see a ton of like sharing. I think it's a little bit more cutthroat. Because if they see that your client has money, they want the client and they're going to promise them the world to get the client. Mm-hmm. But I've never had a patient that's been like, hey, this person can do this way cheaper. I don't play that game. If it's just not something I want to do.
And I agree. I mean, you know, definitely confidence, but the education behind it, you know, you put the work in, and obviously you said you got trained by the people that actually invented that. That shows that you know what you're doing in this niche, you know what I mean? And that pays off a lot. You know, you can guarantee results. You can go in there and actually explain to the client what's going on.
Yes.
Not just feel like, I kind of got to pull back because I don't know
Mm-hmm.
exactly what I can do for them.
Exactly. And well, that's the thing, you know, when I see that a client comes in and they're like, oh, I've been to this provider, oh, I've been to this provider, and I saw them and I got treated and I didn't get results. Well, why? Because either that provider wasn't trained, didn't know what they were doing, or there were other issues that that provider may have missed. Mm-hmm. And that's why it's very, very important in the beginning to establish with that patient, do a correct exam, and figure out for them what is going to be the best, because I will tell them up front, this is what I can do for you. And these are the results that you're going to be able to expect. So there are expectations from the beginning that they will have.
Nice, nice. Is there, now I always ask, is there anybody on Instagram that you can follow as far as like providers or doctors? But is there, and I know you don't use Instagram as much, but is there anybody in general, as far as doctors or even providers that you really like their work, you like what they're putting out into the industry that you can suggest for other people to look up?
So there is an amazing nurse practitioner locally and also has offices in other states. Shining Way Aesthetics. Nice. Very, very interesting provider, great touch with, you know, face, does all the injectables, does PRP, also has an office in Texas and in Northern Florida, and he has amazing hands.
Wow.
So he is, if I had to have something done, because I don't think I can inject my own face, I'm good, but I don't think I can do that to myself. That's where I would go.
Nice, 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 nice. Is there any, I know you mentioned conferences, but as far as when providers reach out to me, they're like, I don't know where to go get trained. I'm new in this industry and I don't know really what to do. What are some ways that they can break into the industry? Is there certain trainings they should attend, or tell us a little bit about that?
So it depends on how they learn.
Yeah.
I like one-on-one, because that way I can spend a lot of time with them, answer their questions. And when I train somebody one-on-one, I leave it that they can always call me if they have a question or if they have a question about a client. So usually when I do the one-on-one trainings, if they, you know, what I always say is, if you have a client that you want to work on at a discounted price and they're willing to let you learn on them, bring them with you. So that's kind of how I do it. And I typically do more one-on-one trainings than I do group trainings.
Yeah, because I find that one-on-one works well because you get to ask questions. And a lot of times you feel kind of dumb when you are in a group, you're asking questions and you feel like nobody else is thinking the same thing, even though they are. It's cool to be able to speak to you, ask you, and then even have your number after in case of something happening. Mm-hmm. Now, a lot of providers experience vascular occlusions. Mm-hmm. Can you touch on that a little bit and how to kind of prevent that?
So I'm kind of fortunate because I don't use those fillers. So I've never had to worry about a vascular occlusion, because when I inject a face and, oh my God, the triangle of death, I never have to worry about that with PRP. You don't have to worry about a vascular occlusion because you're injecting their own blood. Yeah. So I actually am in that very fortunate situation where, you know, other providers have to have a dermatologist or a plastic surgeon that are literally on top of them to make sure that, God forbid, they have a complication. I actually don't. Nor have I ever had a complication because it's their own.
Yeah.
And I don't have to worry about a foreign substance that's going to cause a problem.
Wow. Wow.
Different way to do things, I know.
Yeah, for sure. Super, super, super interesting. I love it.
So this nice young lady. So this is before, 24 hours later, and a year later.
Wow. So what did you do to kind of first assess this and then get this patient to this point? Oh, it's amazing.
Night and day, right?
Yeah.
And that was, I hate to say it, and she's older, but she's not like one of those people who does like the skin creams and all that. She is not that person. So aside from me doing that and her washing her face in the shower, that's it.
Wow.
But you can see, like people say to me, do the results last? Yes, they do. So that's like one of the things. So this gentleman, this is like kind of the healing. So before, immediately after, and that was 2 days later. So he was a boxer who had his orbits broken more than once.
Wow.
And was so sunken in.
Yeah.
And so I used PRP to put it back.
Wow. That's amazing. And how long did the results take to kind of put in effect?
Like for what?
Final results.
Oh, within 3 days, he was 100% healed.
Wow.
Yeah.
Wow.
Oh, yeah. I mean, I don't play when I do these things. I'm very big on these.
Yes.
So this is, she's in her 70s.
Yeah, this is the one I was talking about. This is amazing. Amazing stuff.
She went out 24 hours after the procedure and was partying.
Wow.
She's in her 70s. She's got a 50-year-old boyfriend. She's kind of a trip. But like when I say doing the fillers, so.
Yeah.
And it stays.
Yeah.
So one of my most recent clients, she had a torn ACL, MCL. I repaired the knee. She's a runner. Repaired it, and she's in her early 50s. She came in, she said to me, can you fix my face? Sure, I can fix your face. So she's not a makeup person. So I did her face. I actually did her lips, like she had no lips.
Yeah.
And yeah.
Wow. That is extreme stuff. It does work.
It's like
work.
Amazing with what it does. But like her lips.
Wow.
And then she heals in it it's like this natural looks. They look like what did she have done?
Yeah. Super cool.
It is. And it doesn't dissolve. And it doesn't go away.
So tell us a little bit more about the Oshot and the Pshot. Okay. What are the advantages of it, and who would be a good candidate for it?
Okay, so it depends on Oshot and Pshot can be done for aesthetic enhancement, strictly aesthetic enhancement, or it can be done for repair. So for women, if they feel that they don't have clitoral orgasms easily or G-spot orgasms easily, those areas can be specifically injected. So that's enhanced for them so that they can orgasm more easily. So while you're there, we can also fix other things. So if they've had a child and they are one of those people that when they laugh or sneeze, cross their legs real quick, we can fix that and make that go away. So that's more of a repair versus an aesthetic enhancement. But by fixing that, we actually enhance the G-spot area. Other things that can be done for women is that we can work on the Skene's glands and make it that they get wet like they did when they were teenagers. So now they don't have to keep a gallon of lube next to the bed. So it's these little things. We could also tighten up the inside so when they Kegel, it actually makes a difference. For men, if it's strictly for aesthetic enhancement, we can enhance the girth. We can enhance the girth of the corona and the size of the corona, which is the head of the penis. We can do a little bit for the length. It's more really for girth. If they have a problem getting or maintaining, we will do an ultrasound, find where the problem is, and fix the problem. So for men, it's a little bit different.
So how long do these procedures last for patients?
So typically for women, what I find is if they're doing the whole Kegel thing and there was no issue repair-wise that needed to be done, it's typically like a one and done, unless they want to have, more sensitivity. So then they'll come back in typically a couple of years and say, can you put it back to where it was? Because I'm starting to lose some of the sensation because of less hormones. So that's something that can be done. And that's 2-3 years is when they say they notice that it's starting to, wear down. Men-wise, it just depends. It depends on the man. I've had men that, like, when they see how much bigger the girth is, that they say, hey, listen, when can we do this again? How much bigger can we go? And that's just honest. So those are the people that I see every 4 to 6 months.
Wow. So you can keep going with this.
You can keep going, just like those people who decide to keep putting fillers in the bottom or implants in the bottom. You can keep going.
That's really great news, because I know a lot of people use those type of techniques, and sexual wellness is becoming huge down here in South Florida. It's almost like combined with any med spa or plastic surgery office you go to. Mm-hmm. What do you think is next? How can the industry push that envelope more?
Well, to push the envelope, I think they have to make it more acceptable, because nobody talks about it. No. And which is kind of like sad, because sex should be something that's amazing and fun and enjoyable. So like for a woman, if they can't have an orgasm, and if there's something we can do to make them more sensitive so they can orgasm better, why wouldn't we do it? Mm-hmm. And if a man can't maintain an orgasm or maintain an erection, why can't we do something to fix it? Because when they go see the urologist or their primary, they get a pill. And that pill is temporary. And then it's something they have to plan for. Mm. So the good thing is, when you do a repair with PRP, it's now not something you need to plan for. Because if you've done the repair correctly, they don't need the pills. Mm. And they don't need the injectables.
Is there anyone that's predisposed to this? This is like hereditary, or how does this happen? Or how do you prevent
like
this?
Like for erectile dysfunction?
Or for women, like, not being able to operate correctly?
I don't know if it's necessarily like a genetic thing. I think a lot of it, can be physical, can be psychological. I mean, that's why I think talking with the patients beforehand is the utmost of importance, to find out what the issue is. If they've never been able to orgasm in their lives, why? So I think that's like 90% of it. So if you can figure that stuff out, I think the rest of it comes pretty easily, literally. Yeah. And I think that I've noticed that a lot of men 40s and 50s is where they really start having problems. Mm. And a lot of it's due to issues with blood pressure or diabetes. So I recently had a gentleman call me. He's 52. And it's been at least 3 years since he's been able to get and maintain an erection without medication.
Wow.
And now the medications aren't working.
Wow.
So he's in his early 50s. He wants to be happy. He wants to have sex, and he can't have sex. Mm-hmm. And when he went to his doctor, he's like, here, have another pill. Mm-hmm. But what happens when the pills don't work?
Yeah.
And what's your next option?
Mm-hmm. Do you treat like the high blood pressure, cholesterol too, or is it just like the...
So I do. So because of my internal medicine background, if they do need to see an internist, I absolutely can see and treat them for that.
Nice.
So I kind of am like all in one. So internal medicine, interventional pain management, and aesthetics.
Wow, that's amazing. That's amazing. Thank you so much for sitting down with me, speaking more about the industry. I've learned so much in this interview, and I'm sure everybody watching will learn a lot too.
I hope so.
I can't wait for them to see the pictures of everything that you just showed me, because it's literally amazing. And tell everybody where they can find you, if they want to use your services, how they can contact you and things like that.
Okay, so you can find me on Instagram as Tracey ARNP. Can find me on Facebook. They send me a message, or they can just call my cell phone. Mm-hmm. And the number is 561-901-1182. And they always get me, because I'm the one who answers the phone.
Nice. I'm going to drop that information below so everybody can check it out and check her out. These amazing results. I can't wait to hear from everybody that actually follows and see the results. Amazing, amazing. Well, until next time, goodbye.
Thank you.